Hello, everybody. My name is Diana Soto, and I am a student at Indiana State University's LPN to BSN program. I am going to be talking about postpartum depression today. The following are learning objectives for postpartum depression video today. The first one is I would like the audience to learn what is postpartum depression. Number 2, the audience will be able to identify symptoms of postpartum depression. Number 3, the audience will have the phone number for the National Suicide Hotline. Number 4, the audience will know what postpartum psychosis is. And number 5, the audience will be able to identify some causes of postpartum depression. Before I begin the rest of the presentation, be sure to click the link below to begin the pretest. What is postpartum depression? Postpartum depression occurs after delivery of the baby to the mother. This is due to chemical, psychological, and social changes that occurs to the mother after delivering a baby. According to the DSM-5, which is a manual used to diagnose mental health disorders, postpartum depression is a form of major depression that occurs about 4 weeks after delivery to the mothers. The chemical changes that happen to the mom's body are pretty significant during pregnancy and also after delivery. So the mother produces 2 hormones known as estrogen and progesterone. These are the female reproductive hormones. And during pregnancy, these hormones increase 10 times the amount that they normally would be. After delivery of the baby, these hormones drop back down to normal before or pre-pregnancy, usually about 3 days after the woman gives birth. So this rapid change of hormones can cause, the mother to feel like they're having increased anxiety, having a lot of mood swings. They could have increased crying spells. All these together can kind of amplify the postpartum depression. I want to talk a little bit about the symptoms you might experience due to the postpartum depression. So one of them is excessive crying. Another is increased irritability. Number 3, you would have a lot of depressive moods or feeling like you're very depressed. Number 4, having a lot of severe mood swings. Number 5, sadness, increased sadness, that is. Number 6, trouble sleeping. Number 7, you may have a loss of appetite. Or you may start binge eating. You may start feeling very hopeless. You may have severe panic attacks. You may be unable to concentrate. You may have thoughts of harming yourself or even harming your child. You may experience a lack of bonding with your newborn. And you may have recurrent thoughts of death or suicide. Now, let's talk about some causes of postpartum depression. So the postpartum depression can cause for many different reasons, but here are some reasons why it may happen. Postpartum depression may occur because of physical changes that your body has gone through. Changes in hormones, estrogen and progesterone, just like I had talked about in the previous slide. Can happen because of a lack of sleep. Can happen because of increased anxiety. And can also happen because of self-image changes and maybe not accepting, how your body is looking right now. All these together can kind of amplify and be some of the reasons why you may have postpartum depression. The following are some risk factors of postpartum depression. So one of the risk factors is if you have a history of depression, you may be at increased risk of developing postpartum depression. If you're diagnosed with bipolar disorder, if you have a previous history of postpartum depression, if your baby has any health problems or any special needs, if you deliver twins, triplets, etc., This can also trigger postpartum depression. If you're having trouble breastfeeding, if you're having problems with your significant other, if you're experiencing financial problems, if you have no support system, or even if the pregnancy was unplanned or unwanted. These are some risk factors. I wanted to talk a little bit about postpartum psychosis. So postpartum psychosis is a rare condition. This can develop the first week after delivery or up to 3 months after. So this is when women lose touch with reality. Some other symptoms may be increased confusion or disorientation. The mother may begin to hallucinate. The mother may have delusions. The mother may have increased paranoia. The mother may attempt to harm herself or the newborn. If you notice any of these develop in yourself or anybody else, it's important that you seek immediate treatment. This must be treated in order to prevent any further complications. You may be wondering, when should you seek help from your doctor? So if symptoms consist for more than 2 weeks, you should consider reaching out to your doctor and having an appointment so you can talk about possible postpartum depression. If you notice you're having trouble taking care of yourself, you should also reach out to the doctor. If you notice yourself having troubles taking care of your baby, this can also be a sign. And if you cannot complete daily tasks, this might be another sign that you may need help. So please seek help from your doctor. And I want to stress that if you have any thoughts of suicide and you are actively planning, something to harm yourself, please call 911. Or you can call the National Suicide Hotline at 1-800-273-TALK. There is also an option to chat with somebody one-on-one on the link that's provided there on the slide. So you can use that link there to talk with somebody if you have thoughts of harming yourself or even anybody else. On this slide, I have 3 links that are useful for you if you are dealing with postpartum depression. The first 2 have to do with the suicide prevention online chat and other resources available to you, as well with that phone number that I had talked about. The third one is ACOG regarding postpartum depression for women. So there are several different questions in there with responses that women may have in regards to their postpartum depression. Thank you for watching my presentation on postpartum depression. Be sure to click the link below that says Postpartum Depression Post-Test.